Hi, this is Dr. Christina Hammer with Vibrancy VIP MedClinic here to talk to you about the thyroid. So a lot of people say, hey, how do I know something's wrong with my thyroid? Well, the thyroid will give out certain symptoms, and it's a little bit mystifying because sometimes those symptoms can kind of correlate with our hormones. Now, the thyroid itself is considered a hormone. Now, what are some of the symptoms that a lot of my patients complain about? Well, one is fatigue, low energy, feeling like they're hitting a wall around 2 or 3 o'clock in the afternoon. Feeling puffy face, puffy fingers, puffy toes, even puffiness around the tummy. Another thing is mental fog, kind of feeling like I can't think, everything kind of feels like a brain fog in the brain. Another thing is sleep issues, having issues falling asleep, staying asleep, as well as waking up refreshed from their sleep. Feeling constipated, feeling like, hey, no matter how hydrated I am, as well as how much fiber I include in my diet, I'm still constipated. Having dry or itchy skin, maybe even oily skin. Maybe feeling like your hair has thinned or even falling out. Brittle, your hand, the nails, brittle, falling off, unable to grow long nails. Don't judge mine because my thyroid is affected as well. Another thing people have is either maybe a slowed heart rate or maybe an increased heart rate, sometimes vision disturbances. The most common thing that I usually see with my patients is menstrual irregularities. Now for you men, you're not gonna have that, but for my females, it can cause heavy as well as irregular cycles, maybe even breakthrough bleeding in between that cycle each month. So that is why that thyroid is very important to optimize. So because that thyroid affects so many different symptoms in our whole body, from our head down to our toes, the most important thing is knowing each symptom that it can cause and create. So I'm gonna have a list on my website and a link that you can click on for the list of descriptions for those symptoms. So a lot of times people will tell me, well, Christina, how will I know if I have a thyroid issue or if it's my hormones are imbalanced? Well, that's a great question. I like to tell my patients, I like to check everything. Why is that? Because I like to make sure everything's optimized, from our nutrition, our vitamins, our hormones, as well as that thyroid. Yes, I did say that that thyroid is considered a hormone, but I tell people the hormones that we're checking on top of that thyroid, we're gonna put in together as a combination to make sure we are not missing anything. With that thyroid, a lot of my patients will come in to say, hey, I've had my thyroid check even just this last year and everybody said it was normal. Well, the thing that they're lacking is that a lot of providers only either check the TSH and the T4. TSH just stands for the thyroid stimulating hormone, which is a very important hormone that sets our metabolism up for our body. Factors, but we have a whole list of other factors for that thyroid that we like to check. So why is that thyroid important? Thyroid is all about positive and negative feedback loops. If one is low or even elevated, it's not going to communicate to the next step that's in that process. So I like to tell my patients, not only are we checking the levels, but we like to check the symptoms. So the thyroid, a lot of people will just say hypothyroidism. Well, there's a lot of factors that go in behind that. To me, I like to break it up into 3 categories: primary, secondary, as well as tertiary. So with primary hypothyroidism, that's when the T4 or the TSH, that thyroid stimulating hormone, aren't optimized, or they're elevated and not communicating and going forward with their message. How I like to look at that is we have too many people in the workplace not really completing those job tasks. They're hanging around the water cooler and they're not doing the job tasks that are demanded of them. So secondary hypothyroidism is when that T3, whether it's the free or the total, we don't have enough of those in the workplace. And how I like to explain it is it's kind of like what our job force is right now. We don't have enough bodies in there to perform all the tasks that are needed to complete in our body to help optimize those levels. So it's like one person doing maybe 10 people's jobs to try to complete those tasks. Well, when we have so many tasks in a day, we can't complete them. Tertiary hypothyroidism is when all our thyroid levels are nice and normal, but the patient has experienced the symptoms that we've listed previously, as well as in that link below. So even when those thyroid levels are normal and people are experiencing some symptoms, we still want to treat that, whether with supplementation or medication, so that way that patient has a better quality of life, as well as not are symptom free. So a lot of my patients like to say to me, hey, I've heard once you started a thyroid medication, you have to be on it for life. That isn't necessarily true. So a lot of times when we get down to the root cause of what's causing that hypothyroidism, we can sometimes get people off that thyroid medication and just be on a supplementation that helps support that thyroid as well as optimize their levels. Sometimes what we like to say is it's just kind of giving it a little kick in the butt and resetting that thyroid so that way it helps optimize, just because of what we've been putting in our body. So a lot of times people want to know, what is causing my hypothyroidism? Well, I tell people there's a lot of different factors that can contribute to the hypothyroidism, whether it's stress, inflammation, which comes from our food or drinks, genetic factors, predispositions, a family medical history of either autoimmune disorders or even thyroid issues in itself. A lot of times people don't know that it is passed on from generation to generation. And as we age, sometimes that thyroid can kind of give out on us. And like I said, we just kind of need to reset it a little bit so that way we can feel optimized. When we do start a patient on a medication regimen, I like to do close monitoring. Just like any hormones in the body, the earliest that I want to recheck those levels is possibly 6 weeks, no later than 3 months. Why? Because I want to make sure that those hormones balance in our body, and sometimes it can take up to 3 months for those levels to optimize out. Now, I tell patients, once we get those levels to where it needs to be, that is where we're going to keep reassessing and rechecking and reevaluating that patient to see where they need to be on those medication regimens. So the key in patient success with their treatment regimens is really listening to any concerns as well as any questions that they may have regarding their health and trying to find a solution for them. Thank you for joining me with this video today. This is Dr. Christina Hammer with Vibrancy VIP MedClinic. Remember to click that link below, hit that like and subscribe button, and give us a call if you have any questions and concerns, and I'd be happy to give you a consult.